Now, let's switch out of school and go into how do we implement the formula for success? I call this a rational, directive, and supportive and empowering approach. But before I share with you the formula for success, let me just highlight the formula for disaster. And many times I've seen myself in this left-hand column, disaster. The first one is if I have a bias or prejudgment, I know what this person needs before they even tell their story, before they open their mouth. I'm not going to really be present to listening to them. And if I'm not practicing good self-care, I sometimes become insensitive to the human being sitting across from me. And when my only tool is a hammer, I see everything as a nail, and confrontation becomes my favorite clinical tool. When we add these lovely ingredients together, it always leads to a power struggle. And believe me, when we get in a power struggle with our clients, nobody wins. We may think we win because we knock them into compliance, but it's a malicious compliance. They may think they win because they're going to just walk away, or they'll move into a different subtle form of malicious compliance, pretending, oh, yes, you're right. But nobody wins a power struggle. So we move into the formula for success, getting rid of that prejudgment or replace it with understanding. And to gain that understanding, we need to close our mouths and open our ears and really listen to what the person's saying, what their body language is saying, and what they're not saying. We need to really understand this fellow traveler on classroom Earth. What are they experiencing? Once we get that, we can have empathy and compassion, but never sympathy. Sympathy kills addicts and alcoholics. Empathy and compassion, however, allows me to say, if this were someone I love dearly, or if this was me, how would I want to be treated? And instead of confrontation, well, confrontation is still taught as a clinical tool, but that word itself to me means power struggle. So I replace it with positive, strength-based challenge. Empowering, positive, strength-based challenge. So when we add this understanding, empathy, and compassion, and positive strength-based challenge together, this leads to collaboration. We're working with people instead of working on people. And I believe we need to implement this formula for success to have good treatment outcomes. So that's the formula for success. Now, the next step I want to teach people is what are some really crucial tools people need to move from stabilization into early recovery? Thinking of the developmental model I showed earlier. Well, first of all, requires helping people identify and managing their stress levels, because increased levels of stress will lead to uncomfortable emotions and eventually cravings. So that's the next one. Normalize and manage cravings. People in early recovery are going to have thoughts and even urges and cravings to pick up again. It's normal. A lot of people are shamed by that, and they don't want to admit it to anybody because people will think they're not working a good recovery program, or they're not getting anything out of their treatment program. So we need to normalize that and teach them some good craving management tools. The next step is post-acute withdrawal. Terry's book, Staying Sober, talks a lot about post-acute withdrawal. There's 6 major symptoms, and we need to teach people to identify and manage those symptoms of post-acute withdrawal. And the last one is teach them how to see they're creating relapse justifications at that 10 o'clock on the relapse cycle. How life may be giving them situations that they could read as a justification. If other people were experiencing this much pain and problems, they'd drink or use too. So these are some of the very crucial and important tools. Now, if people have a co-occurring, coexisting PTSD, anxiety, depression, These tools are also going to be important, especially the stress management. I want to help people manage stuck points in recovery. Terry wrote a book that was called Passages Through Recovery. And at the end of the book, he had a recovery-prone way of dealing with relapse and a relapse-prone way. So I'm going to start with the relapse-prone way. So people that are in a relapse-prone way probably are not working a good biological, psychological, social, and spiritual program of recovery. They're probably going through the motions, pretending to get by. So when they hit a stuck point, and a stuck point can be anything that raises stress and anxiety levels or causes pain or problems, they hit it with evasion and denial. They put blinders on. They don't want to think about it and talk about it. That does not make the problem go away. And if the problem worsens, their stress levels build up. Now, stress is also the key to post-acute withdrawal and craving management. And for PTSD and anxiety disorders, it's absolutely crucial that people learn relaxation response skills. So when people's stress builds, they don't have the tools. And they move into the 5 o'clock position on the relapse cycle, and they implement compulsive or impulsive behaviors in order to cope with this angst. Then they move into isolation, avoidance. They avoid people who are in the solution, and they're drawn to people in the problems. This leads to more bad decisions and more problems. So the problems multiply. And when these new problems pop up, they evade and deny those. So we want to move people out of the relapse-prone way of managing it to the recovery-prone. The first step in teaching people how to build a recovery-prone way of managing stuck points is to assess how they're functioning biologically, psychologically, socially, and spiritually. So I have an instrument I use. I rate each area on a 1 to 25 scale. So on a score of 1 to 100, where are they at? And a lot of people in the stabilization stage are usually down at 40 to 50 range. And I want to get their scores up, ultimately up to 80, 85. So building a good biopsychosocial spiritual recovery plan is crucial. Then that person has a fighting chance when they hit a stuck point. It could be a divorce. It could be getting married. It can be getting fired or getting a new job. It can be a lot of different things. It could, but when they hit that stuck point, they hit it with conscious recognition. They recognize, oh my God, this is a problem. Now, there's still a risk here because some people in recovery mistakenly believe that now I'm in recovery, bad things shouldn't happen to me. And they get into a shame reaction when this happens, and they pop back over to the relapse-prone way. So next step in the recovery-prone way is to accept that it's normal and okay to have problems in life. Every human being on classroom earth has problems. And just because you're in recovery doesn't mean you're not going to have problems. So you need to get into some acceptance. It's normal and natural to have problems in recovery. But I can't stop there. I need to move to the next step. And this is to put myself in timeout, to detach, to gain some perspective. Especially if you're at that crucial decision point about to use or not to use. I'm going to give you some tools later on to handle this particular point. Then the next step, once I get that time out, I need to ask for help. I need to ask for my accountability partners, my recovery partners, my therapist, my counselor, my coach, or my higher power. I need to ask for help and/or my higher power. Then that's not enough, though. I can't expect other people to do it for me. I need to respond with action. And Terry called that the radar method. So I tell people, which is your choice, escape or radar? So managing stuck points in recovery is possible. And you need to do the footwork.